Hello everyone, welcome back to my channel. In this video, we'll be discussing about angular bacterial conjunctivitis. First, let me discuss the topic. Afterwards, at the end of this video, there will be a revision, and at that time, I will show you the images related to this topic. So, let's get started. Angular bacterial conjunctivitis is also known as Diplobacillary conjunctivitis. Basically, it is a type of chronic conjunctivitis in which is characterized by the inflammation of the conjunctiva as well as the inflammation of part of the eyelid margin which is close to the angle of the eye. So the name angular bacterial conjunctivitis. Bacterial means it is caused by a bacteria. Angular means there is inflammation of the eyelid margin which is a part of the eyelid margin close to the angle of the eye. Along with that, there is a maceration of the skin surrounding this area. Next, let's see the etiology. First, let's see what are the predisposing factors. First one, chronic exposure to the dust, smoke or any chemical irritants. Consider the people working in such dusty environments. That is the first predisposing factor. The second one is the local cause of any irritations like concretions or any other foreign body. Third one is any eye strains because of some refractive errors or some convergence insufficiency. The fourth one is alcohol abuse, and the fifth one is the people having some metabolic disorders, and the last one is the people who are not having enough sleep, means insomnia. It is about predisposing factors. Do you know which organism is causing this condition? It is most commonly caused by the Moraxella axenfeld, which is a Diplobacilli. So the angular bacterial conjunctivitis is also known as Diplobacillary conjunctivitis because it is most commonly caused by the bacteria Moraxella axenfeld, and rarely it is caused by the Staphylococcus aureus also. So what is the source of infection? The source of infection is the nasal cavity. Then what is the mode of infection? Mode of infection is from the nasal cavity to the eyes through the contaminated hand or handkerchief. That is the mode of infection. Next, let's see the pathology. In pathology, when I tell you about the pathology, you just try to imagine like a story. Consider the bacteria Moraxella axenfeld, which is producing proteolytic enzyme. This proteolytic enzyme get accumulated at the angle of your eyes because of the action of the tears. Once it gets accumulated, what it will do is it will macerate the epithelium of the conjunctiva, lid margins and the skin surrounding that area. Once the maceration happens, the vascular and the cellular response begin and there will be mild chronic inflammation. As a result of this inflammation, the skin show eczematous reactions. This is the pathology. Next, let's see what are the clinical features. First, let's see the symptoms. For symptoms, I have a mnemonic. It is BIRD, B-I-R-D, BIRD. B stands for burning sensation. I stands for irritation of the eye, R stands for redness of the eye, and D stands for discomfort of the eye as well as dirty, white, foamy discharge from the eye. This is the symptom. You have a mnemonic BIRD for that. The signs of this condition involves, the first one is the hyperemia of the bulbar conjunctiva near the canthi. And the second one is the hyperemia of the eyelid margins near to the angle of the eye. The third one is the excoriation of the skin. And the fourth one is there will be a foamy mucopurulent discharge from the eye at the angle of the eye. These are the signs. What are the complications of this condition? First one is blepharitis, that is the inflammation of the eyelid. The second one is shallow marginal catarrhal corneal ulceration. These are the two complications. Next, let's see the treatment. First, in treatment part, let's first see the prophylaxis. That is the first thing in prophylaxis is maintaining a good hygiene. That is very important. And the other thing is the treatment of the associated nasal infection, because in this condition, in this angular bacterial conjunctivitis, the source of infection is from nasal cavity. So in prophylaxis, maintain a good personal hygiene, then treat the associate if there is any associated nasal infections. The curative treatment include the 1% oxytetracycline ointment 2 to 3 times a day for 9 to 14 days. This will eradicate the infection. And the second one is zinc lotion can be instilled on the daytime, and zinc lotion can be used on the bedtime, which will prevent the proteolytic ferment and which will reduce the maceration. We know the maceration is because of the proteolytic enzymes produced by this bacteria, right? So the use of zinc lotion on daytime and the zinc oxide in the bedtime reduce the production of reduce the maceration by reducing the proteolytic ferment. Here is the quick recap. The angular bacterial conjunctivitis is also known as Diplobacillary conjunctivitis, and by definition it is a type of chronic conjunctivitis characterized by the mild grade inflammation which is confined to the conjunctiva and lid margins near the ankle, and it is also associated with the maceration of the surrounding skin. And next, after definition, you write about the etiology. In etiology, first you will write the predisposing factors, that is the chronic exposure to the dust, smoke and all, and the second one is local cause of irritations like concretions and all. Third one is eye strains due to some refractive errors or convergence insufficiency, then people with alcohol abuse, metabolic disorders and insomnia. And the causative organism is commons one is Moraxella axon-filled, and the rare one is Staphylococcus, and the source of infection is nasal cavity. Mode of infection is from the nasal cavity to the eye by contaminated fingers and handkerchief. And the pathology include the Moraxella axon-filled bacillus produce the proteolytic enzyme, and this proteolytic enzyme get collected the ankles by the action of the tears, which in turn macerate the epithelium of the conjunctiva, lid margins and skin surrounding the ankle of the eye. And because of this maceration, the vascular and cellular response gets started, and as a result of this response there will be a mild grade chronic inflammation which in resulting in the skin shows some eczematous change. On clinical feature, first you write about the symptoms, and here you have a mnemonic bird. B stands for burning sensation, I for irritation, R for redness, and D stands for discomfort in eye, as well as the collection of dirty white foamy discharge at the ankles. And in case of signs, you write about the hyperemia of the bulbar conjunctiva, two hyperemias, hyperemia of the bulbar conjunctiva, hyperemia of the lid margins, and excoriation of the skin and foamy mucopurulent discharge. And the treatment on prophylaxis, the first and foremost thing is maintain a good personal hygiene, and then the treatment associated, if there is any associated infection, nasal infection, you just treat that. In curative treatment, oxytetracycline 1% eye ointment is used 2 to 3 times a day for 9 to 14 days, and this eradicate the infection. Second is the zinc lotion is used during daytime and zinc oxide during the bedtime, which will inhibit the proteolytic ferment and which will reduce the maceration. And here is the image. Here you can see the maceration of the surrounding skin, the inflammation of the conjunctiva, the lid margin inflammation, and this is the image of angular conjunctivitis. And this is about today's video, and if you have any suggestions, just comment below.